Let me just to introduce myself, I have different outfits, but the one I think of interest here today will be the MHPSS Opportunities Career Network. Recently, I rebranded it. It is now called MHPSS Premium because we now started charging a little fee for people to join and get mentored in their careers. A lot of people are asking questions about how do I become a global mental health practitioner, number one. Another one is a major question on scholarships. How can I get a scholarship to advance, especially postgraduate scholarships? People don't know how to do that. And then number three is there a one-stop shop place where I can be guided from beginning to end so that I get out of my comfort zone? What most people have realized is that there are not enough jobs. So then the option, aside from employment that is there, is entrepreneurship. And I've been asking people, are you entrepreneurial enough to think about what else you can do if you cannot find, any job in the mental health space? Seems to be a lot of work, but in terms of value for money or people investing in the mental health practitioners, there seems to be some gaps. And so there's something like the inherent value of the practitioners that needs to be built up so that people can submit this value to the people who want to engage them, So those have been like majorly the questions, and I'm sure you have very good answers for each one of them. So maybe by way of introduction and highlighting your major career trajectory, you can tell us, who is this Dr. Japheth or Adina, or AKA Jeff Adina? So please introduce yourself.
Thanks, Joyce. I've been in the mental health space for about 2 decades. And I started my training back in 2000, I think, and 5. I did not get in because I knew what it was. I got in by accident because I wasn't aware that, someone could be trained and become a counselor or become a psychologist. So I think I was just looking for something exciting because I was interested in psychology as a discipline. So I got in. I wasn't even sure that I had the skills to be a therapist. When I got in, I got interested in exploring this deeper and further. And with time, I think I just found myself being a mental health practitioner. And this is something that I've loved. So I've been part of the team that even agitated for the enactment of the 2014 Counselors and Psychologists Act in Kenya. I was the team that brought in the president of the International Union of Psychological Sciences in Kenya. We met the minister back then. It was Minister Macharia. We talked about the place of mental health in Kenya because by 2014, whether you are a psychologist, we did not have a formal structure of credentializing practitioners. The thing that you realize is when you step out of Kenya, you go to another country, the first question is, okay, are you a psychologist? Are you a mental health practitioner? Are you a counselor? And you say yes because you have a degree. They would ask you, are you registered? Are you licensed to practice? So that's the point. And the next thing would be, okay, if you're registered and you're licensed to practice, what's the level of your qualifications? Because one thing that I think has happened, which is unfortunate, if you go back to the original act of 2014, it stated very clearly that for you to be a psychologist or even a counselor, you must have at least a master's degree. Trade across Africa and also Asia Pacific. So if you go to Africa, you must have a master's degree for you to be a professional counselor or to be a psychologist. Now, if you go to North America and also Europe, in North America, you must have a PhD for you to be a psychologist. Now, look at the amendments that was made to the 2014 Act. That was the act is, is it 2019 or 2012? The current one that mental health practitioners in Kenya.
Yeah, definitely. There has been a series of amendments.
Yeah, so amendment on the basis upon which the registration is happening in Kenya today, it's a good thing that we are having a board in place, but it's also unfortunate that the standards as specified by the board don't align with the international requirements.
Right.
So it's going to be a problem for many practitioners in Kenya to space out there because first, your qualifications be at least a master's level.
Yeah.
Before you can be considered as a mental health practitioner. So here in Kenya, reading through the act, it talks about being registered as a counselor or a diploma. Now, diploma level of qualification is not a professional qualification. A diploma is considered paraprofessional. So you are not a professional. Now, you cannot be a psychologist or a professional counselor if you're not a professional.
Right.
So that the act actually that's a disservice to the Kenyans because you cannot be a diploma in Kenya. You cannot be a doctor with a diploma in Kenya. You cannot be a vet with a diploma in Kenya. So why did they water it down to talk about a diploma? So that's one of the things that should be pointed out. The second, the practice of psychology is so intense, and we expected to take care of other professions. So as a psychologist, you should be working with a doctor, you should be working with engineers, you should be working with other professions. So what that means, your level of academic and professional qualification should be higher than most of these cadres of professionals. And that's why in America, you must be a PhD holder, or you do what you call the PsyD program. That's Doctor of Psychology program. Only then would to the board for registration, and only then could you be licensed to practice as a therapist.
Right.
Now, South Africa, it's at master's level. It's masters. In New Zealand, it's masters, which is a good thing. So because we are still a developing nation, I was thinking that we should have left it intact at 2014 Act, which specified a master's degree. Now that an international appeal as practitioners from Kenya because you go out there, they would ask you, okay, you're a practitioner? Okay, fine. Are you licensed? Yeah. Are you registered? Yeah. What's your qualification? And you'd say, I hold a master's degree either in counseling psychology, clinical psychology, neuropsychology, geropsychology, forensic psychology, or criminology in some cases. So that have a little bit of global appeal, but as it is, it would be hard for me to advise anyone without a master's degree on how to get out there and become a recognized practitioner.
Got that. Yes, there definitely was a back and forth, and I'm so glad you were closely involved in the policy and practice of institutionalizing our credentialing system, which had been a back and forth. And, you know, there was a major tough war amongst practitioners to an extent that at some point parliamentarians told us to go clean house and then come back in one voice. And it's not been easy. It seems like the biggest resistance is within our field ourselves as practitioners. So there seems to be more ideological differences, and some of them maybe were also instigated, or the triggers were probably economic, thinking about numbers and lower cadres will always be the majority and things like that.
I remember when we started movement or the entire process of seeking to mainstream the practice of psychology in Kenya, drive and the motivation was we wanted to gain a global recognition. We were very clear from the get-go that let's rally every person in Kenya who's got at least a master's degree level of qualification in the field of psychology. We have so whether it's clinical counseling, whichever branch you belong to, but we want all these practitioners together and ask the government to create a pathway for recognition. And that would happen if the government takes the leadership role and instituted an act And this act would allow for the creation of a body, that's the board, and the board would registration and licensing power. And once you create that, then you'd be able to have professionals who are recognized nationally, and they can use the national recognition to make a pitch internationally.
Right.
So, but somewhere along the line, I don't want to call them barbarians, but I want to call these people, they came with some other motives, and their motive was actually professional. Their motive was economic, as you mentioned. And so to reach out to people at the grassroots level, people with 1 week certificate in counseling skills, people with a 1 diploma or 2 years diploma or certificate in counseling. And they were told, you know what, we can register you and you can become recognized as counselors and also psychologists. And so join our associations. And I was a little bit pissed off because about an association in the absence of a government regulation in place.
Right.
So when I go out there, no one would ask you if you're a member of an association, because you can join any association, but they would ask you, are you a psychologist? And what's the evidence? I'm registered, I'm licensed. And I also have at least a master's degree. So this came in, invaded the space, and their interest was, some of them just wanted to be appointed to the board for the fish gains, and it was not about the profession of psychology. So today, when you look at the registration, you the form asks you to categorize yourself, whether you want to be a counselor or a psychologist. That's wrong. It's not supposed to be like that. What makes you is your qualifications. The board, the evidence you give them is, I have a PhD, I have a doctorate, or I have a master's in psychology. So the board would just register you based on that. Now, if you don't do that, you are not supposed to be registered for anything. Actually, registered. Then when it comes to licensing, we not license people based on levels, like level 1, 2, 3, and 4. That's not license. A license is basically a permission to practice. Means is I'm permitted to practice when I'm licensed. Like a shop, someone who owns a shop. Once you've been given by the city council or whoever gives it, it doesn't matter how many products you sell, what products you sell, you permitted to sell. You're a shopkeeper, that's what the license says. But for you to get the license, there could have also been certain conditions which you meet those conditions. There must be a criteria specific clearly that you must have X, Y, Z. So in this case, we should have made it very clear that before you get your registration, we want to see your master's degree. Once registration, you go into the principal register of mental health practitioners. And so with you become either a professional counselor or you become a psychologist. That's now I want you to look at the sister profession like psychiatry.
Yes.
For you to be a psychiatrist, you must have a master's degree in psychiatry. So
which is a specialization, medical field, those are specialists.
Explain would someone with bachelor's degree or a diploma is going to write comprehensive psychological assessment report that will be by a psychiatrist to whom they're referring the patients. Do they have that kind of training? Now, the second problem that I want to talk about here is, do we have what it takes to train psychologists in Kenya? Had a bit of international exposure and I also have local exposure, so I can speak to this subject authoritatively. So what you'd notice is that the kind of training that we have in Kenya assumes that we can train psychologists at bachelor's level. Now, as a discipline or as a field of knowledge is so complex, is so advanced that you cannot break down to a bachelor's degree 4-year program. It's more than so. Bachelor's degree is intended to give you a little bit of foundational knowledge in the field, but it's to make you a professional and a practitioner. So if you Other jurisdictions, what they would do is a student would sign up for a bachelor's degree program. They would do psychological science, or they would call it Bachelor of Arts Psychology.
Mhm.
You're done with that, or in some places you could do a Bachelor of Arts and you major in psychology.
Mhm.
That, then you apply to grad school. When you apply to grad school, you go in the case of North America, you'd go in for 7 years.
Mhm.
During this, you will have the clinical courses and the research programs that would lead up to a doctor of psychology or a PhD.
Mhm.
So what makes you the professional is the postgrad training. It's not the undergrad training. That's why you cannot have doing a bachelor's of psych. I see some called bachelor's of counseling psychology.
Mm.
Counseling psychologist at bachelor's level. You become a counseling psychologist at master's level because you already have a foundational degree in psychology. So what you do now, specializing, you're focusing on the counseling psychology practice.
Mhm.
Decide to go clinical, or you decide to go geropsychology, or you decide to go neuropsychology, or you decide to combine whatever combinations are available to you. So that's the point. Start now becoming a psychologist. Because look at it this way, at bachelor's level, what resources do we expose these students to? Zero.
Mm.
Psychology to take you to the lab. Do we even have universities public universities in Kenya don't even have a psychology lab? As a matter of fact, psychology, because I've been a teacher in Kenya, lecturer in Kenya, is
Mm.
very, it's taught the way history, anthropology, and sociology are taught, which should
Mm.
not be the case. We're supposed to have psych labs where we teach students assessment, we train them for therapy. We have like studios where they would go to do record their sessions, where they start learning principles and the practice and the applications of the skills. Now, that's not, we have out there with degrees from public universities in Kenya, and these degrees are like Bachelor of Art Psychology or Bachelor of Psychological Sciences or Bachelor of Science in Psychology. And these people have no idea of what happens in a therapeutic setting.
Yeah.
For that reason, why it's even wrong for the board to start thinking that you can register someone in Kenya at a bachelor's level to be a psychologist. So the reason why this would be a little bit more appealing is because at master's level, the students get some of these and get to practice some of these skills, some of these techniques, and the training is a little grounding than what we have at level.
Yeah.
And so I know that it's going to be a struggle for many people because how would someone with a bachelor's degree even run a psychological practice clinic?
Right.
Do you have the training? Do you have the tools? Do you have the level of competence that's expected of you? Can you even be able to formulate your own theoretical framework of practice? You take. So my advice to anyone out there, if you already have a diploma or a bachelor's degree, you need to upgrade, go back to school, do a master's course, and your master's course should be as practical as possible so that you can use that as a basis of going into your own practice, or if you feel like you want to move to a different setting, different country, different jurisdiction, you can easily your credentials to appeal to the regulating authorities there to assess you for an equivalence to see if what you aligns with what they have. And so they put you in some sort of a transition program so that familiarity and some, you get the hang of what happens exactly in that jurisdiction, what's expected of you, certain things that you need to learn. So it will be easier for you, be a lot easier. But with the qualification we have today in Kenya, what it means is for you to go out there, you must first apply to be trained again. And training, if you have a bachelor's degree, you have to apply to go there to study for your master's. And after master's, you could go in and study for a doctorate, or you could go for a PhD so that you can get qualifications that are necessary requisites for a professional registration.
Right. There are two contexts of entry into the schooling, I liked your second question on, do we have what it takes to teach psychology in Kenya? What I've seen is hanging degrees. So people doing their first degree in psychology at master's level, while their bachelor's was maybe in finance or accounting or something different. And some universities will require prerequisite courses, but others will not. They come straight in and they're hanging. Second thing I've seen is a lot of people preferring the hands-on approach of diploma. And this is a report I've gotten from many people. In my own case, I did both the diploma and certificate levels as well as bachelor's. So I've done all the different levels in the field, at least in Kenya. So when people have decried the bachelor's and postgrad programs as being too academic, at least for some time this was the case. I know right now universities are working very hard to shift around that narrative that academic degrees are not practical enough. So there has been a school of thought about diploma being the real deal for the practical side, and the degree being more equipping on the theoretical side. And that has been mainly because of, I think, some mediocre kind of programs. I think I was very lucky. I went to really good programs throughout, but this has been a report I've had. So maybe comment on the two, the hanging degrees, that way of entry, and this other thing about equating diploma to practical and degrees to like only purely academic.
Yes, I know where that comes from. A little bit of history to that. The first people who started training in psychology in Kenya, these were employees of TSC, Teachers Service Commission. So TSC came up with a package for high school teachers that there was need back in late 1990s towards 2000s that we were seeing cases of indiscipline and cases of truancy and misbehavior and problems with high school students. As schools were getting burned down and bad things were happening, students were drinking and all sorts of behaviors. Now, it was on that basis that the TSC started creating a scholarship program for teachers, high school teachers, to go in and do a master's degree in guidance and counseling. That door, and many teachers got into that space while they were focusing on guidance and counseling. Others say, okay, instead of doing guidance and counseling, I'll go in and do educational psychology. Now, educational psychology were the programs that TSC would give you study leave on. So we having people who had done mathematics, people who had done geography, people who had done chemistry, coming master's study something that looks like psychology. So that's it, doing guidance and counseling and psychological, educational psychology. Now, so what happens with time toward late 1990s and early 2000s, we started certain institutes coming up which were not university institutions. So we saw institutes coming up like a money counseling center, KAPC, IPC, and these other institutions who said, okay, fine. For us, we would start on training people at certificate and diploma levels so that they can counsel us. Now, when all this started, we never had a structured approach by the government towards this whole thing. So counseling started based on what I would call non-governmental approach. For that reason, why there were never even requirements specified by the government that you have to have this for you to go into this program. So people who had bachelor's degrees in different fields coming to do like a diploma in counseling, and that's how they became. So we started having a few universities in Kenya now talking about, okay, create other degree programs at master's level. So all that they would require that you had a bachelor's degree and maybe a diploma in counseling, then get in. So you could just get into a program and do that. Then the admission criteria in our universities were never that strict. So there are people who go and become lawyers and then they jump into a program, a master's program, and start studying counseling psychology, doing a master's of arts in psychology.
Yeah.
So this was just like some sort of nondescript way of approaching this kind of training because the profession of psychology was not deemed sufficient enough by the government. The relevant psychology practice had not been established. The visibility of psychology as a mental health discipline had not, it was lacking actually. It was not there in the foreground. So a little bit messy, hazy, and so people were just moving with it. And you see, Kenyan mentality is that when the NGOs started employing people in that space, there was the wave of the HIV funding and the so this HIV program started employing HIV counselors, testing counselors, revisit. Government started rolling VCTs through NASCOP. So the people who get the diplomas actually were the first ones to be employed. And a factor, a pull from this field that people started going to institutes and universities to do diploma in counseling or something like psychology because there were jobs. And it's a of this nation shows you that our education is largely dependent on the job market. So if considered marketable, everyone would want to join that program, they would want to pursue that program. Now, having said, what are the international standards? How does someone become a psychologist based on the international standards? Like I said before, you need to go through a 4-year degree program where you the theory of it, So to understand a little bit of the theory of psychology, particularly the 4 programs that undergrad degree should focus on, a little bit of research methods, because you need evidence to guide your practice as a psychologist. So there's a lot of research methods. There's a lot of emphasis on statistics because you need to apply psychometrics, statistical tests. That as a psychologist, you need to have a robust understanding of statistics. The other need to have an understanding of neuropsychology to help you understand the brain and how it works. And this you with another cause that what happens when a brain is not functioning normally. So there should also be a focus on psychopathology. And the other we focus on is psychotherapy. So to the counseling skills. The counseling is basically the application of the psychological principles. So sometimes I laugh when I read something like counselors and psychologists board. What's that? It's either mental or it's supposed to be psychology board. Because is a little practice within psychology. It's like this is John, and then you want to say that someone in the family is called Little John and John. So it's like you're saying Little John and John.
Yes. Yes, and that also alludes to our local, this alludes to our local connotations that counseling is not the same as psychology. Counseling is what the diploma people have, just on the surface, and the psychology is what, the higher. There's a lot of that going on.
So, confusion there, and it's very unfortunate that we have that going on, and we need to make it crystal clear to the people out there that there is nothing called counseling and psychology, because counseling is basically based on the principles of psychology. The main discipline, the area of study is psychology. Counseling, small thread that you can pull out of psychology, because how does someone study counseling? You have to go schools of psychology, whether it's cognitive, whether it's behavioral, whether it's psychoanalytic. That's where you draw your skills from and your understanding of the human nature from. So there is no philosophical foundation of counseling outside of psychology. And that's something we made crystal clear to people offering these programs and students who are taking up these programs in universities and other training institutions. So globally, you're supposed to start by doing a bachelor's degree. Once you do a bachelor's degree, then you have to assess yourself and ask the question, do I have the passion? Do I have for me to be a mental health practitioner? So if the yes, then I would say, okay, fine. I would want to go into practice and I would want to be like a clinical psychologist or a counseling psychologist or a neuropsychologist or a geropsychologist. What are the requirements for this? Now, those four areas that I've mentioned, you need at least a PhD level, minimum for that. Okay. If you want to be like family therapist, you want like a school counselor, then after bachelor's degree is a 2-year master's program. At that stage where someone may decide, I just want to be a counselor. So counselors registration recognition is master's level. Counselor, professional counselor with a master's degree. But if you the title psychologist, we expect a doctorate or a PhD in that case. So you need to be in school for at least 10 to 12 years to become a psychologist. From the time you started your master's degree to the time you graduated your PhD. So that's something that should be very clear. And I would say that this idea of people getting grafted into the practice of psychology, it's a no-no. As a matter of fact, I would not even blame this on external forces. I would say this, it takes you to be honest. Today, if I'm putting masters of physics class or masters of chemistry class, and you have no bachelor's degree, would you even understand what you're doing? Even
no foundation. Yeah.
Mathematics or a master's in geography and you have no foundation in geography. The damage that was done to the profession, but I would say that we taking the little strides towards mainstreaming the practice of psychology, which is a good thing, but we still have ground to cover so that we can align what we have in Kenya with the global perspectives and global standards and trends. But as it is, I would say take the individual person to say that I want to make myself a global product. I want to be a practitioner. I can go to different parts of the world and present my credentials and my qualifications and ask for an equivalency assessment, and I would get a positive outcome of my assessment. So it takes an individual person because the government will not do it for you.
Yeah. So I'd like us to switch gears now, and now you can infuse your personal story. I've seen you have a very decorated profile, quite a bevy of publications from your thesis, and you seem to be very interested in depression, both at the master's and the doctorate level, but also many other publications. I also did my research in depression, so I was fascinated by that. I'd like you to tell me how easy or difficult it was for you to move through each of the stages. Mostly, I'm interested in the career transitions. How did you, I mean, I got how you got into the first degree. How did you then decide you would go into University of Queensland in Australia? And was that on scholarship or did you pay? And how did all that happen?
Yeah, it's a little bit of a fun story. It was nothing pre-programmed, nothing planned. For me, I was always interested to become a research scientist in my field. And so, given the work that I used to do before, because before I went into my master's program and my PhD, I was already working in the research space. So, working in the research space, and most times I was working with psychologists, and some of them were from North America, some more Kenyans, and I would see what they were doing and I got excited about that. I was also aware about the deficits that we have as a country in the field of mental health. There were not so many practitioners. And there's also this understanding that, you know, as I think it's about cultural construction of mental illness in Kenya that people who go to see the psychiatrist, these are people who have lost their minds. These are not cases. These are people who have gone insane. And so there's a lot of stigma that comes with that. However, the very basics of studying psychology revealed to me that psychology is not just for the mentally ill. Psychology cuts across the board. Someone wants to focus on a career, they need a psychologist who is specialized in career guidance. Okay, someone wants to employ people, HR department, they need a psychologist who can design an aptitude test so that the candidates could be subject to that, and the HR will be able to get the best of the candidates. So psychology is 96% applicable in positive spaces. It's only 4% applicable in mental illness.
Yeah.
And so what we are conflating here is psychiatry with psychology, because psychiatry, by the very nature of its foundation, it rides on a medical platform. And we all understand what medical doctors do. Medical doctors are there to treat diseases and illnesses. So they basically apply the disease model and the drug model in their practice. So they are not there to take a journey with a client all the way back to early childhood experiences, the ACEs that they got subjected to, the kind of experiences, the trauma in childhood, people growing up, issues with relationships, issues in domestic affairs, issues at the place of work. So psychology is cross-cutting and it's all-encompassing. And that's the reason why I got excited about psychology. So while I was working with this team, I got into a population health program. So within the population health program, you'd hear people talking about NCDs, non-communicable diseases. And what are they talking about? They just talk about physical conditions. Rarely would you hear people talking about mental health conditions. And it got me excited because sometimes I would go up there. I was literally doing coordination in terms of monitoring and evaluation of clinical and research programs. So the data, I could have it firsthand. I could put together these reports that would go to the funders, and I would look at it and I would see the trends, like those who, have, the HIV care programs, population programs, and I would always ask myself the question, where is mental health? So when I did my master's, I decided to focus on depression among HIV patients. There's a research I did previously, and with the team, there was one Dr. Becky Papaz who came from Yale to Moy University, professor the late we passed on last year. So they were at the application of cognitive behavior therapy among HIV issues with alcoholism. And I'm a facilitator of the CBT session. So I got trained and I got certified and I became the facilitator for the project into the Kenya Health Behavior Study. So while I was delivering this, I noted that there was a lot of talk, which to me, having had a bit of psychological training, could point me to mental health, mental disorders, and got a glimpse into the world of depression, because they experiences, why they are struggling with alcohol, why they know that they have HIV, but still they drink, and yet they know that alcohol would affect their adherence to treatment. That's how I got into the focus of depression in this case. And I think I haven't stopped looking at depression population-wise. Also, the other exciting I decided to shift my focus towards what happens in a society or a setting where depression is so prevalent, like Kenya or the sub-Saharan part of Africa, or less developed countries, or low and mid-income countries, because the research out there, whether it's a systematic review, meta-analysis, or just a cross-sectional study, we see like about 1 in 4 women in this part of the world could be presenting full-blown clinical depression or subsyndromal depressive symptoms. So yes, it piqued my interest, and I said, okay, I would like to see what happens. What happens if a mother has depression? And through extensive literature search, reading, and analysis, I discovered that depression is cyclical. What that means, a mother who is depressed, the condition does not stop with them. This condition can actually get to the baby, and it can affect the baby in terms of developmental milestones. It their academic performance, and when they become teenagers, it can also affect like their mathematical abilities, and it predisposing factor for them. So some of them might start experiencing depression in early adulthood. So technically, depression is cyclical. It can move across generations. And that's my research interest towards my PhD that, okay, let me try and see what happens in depression. And does this impact on the developmental outcomes for the infant? And what sort of developmental trajectory is set an infant on? And the next during my PhD is, okay, fine. We know that depression is prevalent among women who are pregnant and those who are lactating. But what can we do about it so that we lessen the burden, we reduce the risk, we mitigate for the effects of this? So literature, and I said, okay, there are two options. They can either go for psychotherapy, which doesn't work like CBT does work. They can also pharmacotherapy, like being put SSRIs, antidepressants, put on that, and that could help with that. But what I say, the literature shows clearly that less than 8% of women experiencing perinatal depression receive adequate treatment. So it means we have a gap of 2%. So we have 92% of women with depression who are falling through the cracks. So who's going to take care of them? So at that point, thinking and saying, okay, outside of the conventional approaches to treating maternal depression during the perinatal period, could there be an intervention that would be easily accessible, low cost, something that can appeal to the mothers without the stigma that comes with mental illnesses? And that's where thinking about how about parenting interventions? Because parenting are designed as preventative programs and focus on helping mothers, whether they have a condition or not, to self-efficacy in terms of parenting, their responsiveness, confidence, and baby, how they deal and relate with their partners, and the kind of support that they need to enlist to help them with the journey of being mothers. They're focusing on pregnant women who are at risk of depression. Technically, they had symptoms of depression, and looking at parenting interventions for them. Does it work? So I had to do a meta-analysis to see do sufficient evidence for me to say that parenting interventions can be effective for perinatal depressive symptoms. So that's what I did. And then I did a randomized trial, which basically confirmed the findings of the meta-analytic review that I did. So I am still this, and the reason for that is because we have shortage of mental health providers in Kenya. We have less than 50 psychiatrists who are practicing, and psychiatrists should be the last line of help. It should not be the first line. We're supposed to have social programs in place, and parenting fits into definition. So it would be easy for me to have like a parenting intervention layered on the antenatal care programs. So when a mother comes for a visit during the pregnancy, it's also good to sit them down and talk to them about them, talk to them about the expectations, talk to them about the baby they're expecting, talk to them about what it means to be a mother, and talk to them about how they get the support from their partners to help them with this journey and how they're supposed to take care of themselves. So that's what about this parenting space and also maternal depression and child development outcomes.
Right. Really amazing. Yeah. So in the case of your doctorate program, was that fully funded, or did you have to get a funded program?
That was a super competitive program because when you go out there to do a PhD, and that's something I need to talk about a little bit, maybe in another forum.
Yeah.
The PhD, as we know it in the Kenyan setting, it's a little different than what you have out there because a Kenyan university would advertise for PhD programs that they offer. A student is asked to apply, you pay 2,000 shillings and you apply. Then you get admitted to the university, and then after you get admitted, they take you through some coursework, during which they ask you to maybe identify some potential supervisors that you can work with, and you literally just go through the motions of it's back and forth, there's problems in supervision and all that, and you can take 10 years struggling to get through the program. So the PhD program we have in Kenya is not structured, and the support that the student and the level of training that the student needs is not offered in the local universities. I'm sorry to say that, but I'm saying that because I have experience in both worlds, and I've been in those both programs in Kenya and outside Kenya. So I know exactly what I'm talking about here. So the PhD program out there is fully funded because we expect you to be 100% student for the duration of your PhD program. So it can be 4 years or 7 years. So when you go in on a competitive basis. So you have, first of all, to develop a proposal, a research proposal. Once you develop a robust research proposal, you have to do a little bit of a scoping review to see to it that no one else has ever addressed the topic. You're the first person to tackle that topic in your PhD. Now, once you're certain about that, you just write like a concept paper, and you start looking around who are professors out there who could be willing to supervise you, who have expertise in the field that you'd like to pursue your PhD in. So you start writing emails and putting together your CV. And before then, you need to start getting some publications of either your master's or the work that you do. You need to have at least 2 or 3 publications in peer-reviewed journals, because as a supervisor, when I see a student who's applying into a PhD program and you had some publications before, it shows me that you have a bit of research experience. So we're not starting from scratch. You have an idea. And when I read through your concept paper and it aligns with my area of expertise, that to me would be an easier way of saying I can easily say yes to the student who's got those that kind of a package, and they're asking for my, to be my student. I would easily say yes to them. So the first thing you have to do, get your publication track, okay, get it up and running. Get your CV ready, get your concept paper ready with a research idea that aligns with the research area of expertise of a potential supervisor. Then write to the supervisor, attach your CV, attach the concept note, and express your desire to have them supervise you for your PhD. So they would read through that, and if they're okay with it, they'd write back to you. Some would want to organize for an interview face-to-face. So they'd want to talk to you to gauge where your interest comes from, what existing skills that you already have, what's your knowledge base like, why specific area of research, why do you want to target that area? Do you know what it takes to PhD program? What are your expectations and all that? So that's the preliminary stage of that. So one potential supervisor, 1 or 2, and then they would now ask you to write a proposal. A proposal, they would ask you to apply to grad school for admission into the PhD program. So to the grad school, the first thing they would do is they would admit you based on the strength of your qualifications, existing qualifications. Once you get to grad school, then you can now apply for a scholarship. If you are admitted and scholarship granted, now you're ready to start your program. So in my case, I had to do both, and I was successful at both. You can make like tens of applications with no success, but there's just one door would open up and you're in. Once you go in there, I want to be very clear on this. A PhD program is a full-time program that takes every ounce of energy off you. So you have to put your best foot forward. You have to be ready for a PhD program psychologically, emotionally, physically, and also a little bit of financially, but with scholarship, it takes care of that because PhD program is expensive. Think like my program was going for $12,000 tuition fee every quarter. So that means at least $48,000 or $50,000 a year. So that's a lot of money. So without school, it's not something that you can sustain. So I would say that if you aim to do a PhD, look outside there and also ask yourself the question, three things. What kind of a supervisor am I looking for? What kind of a university do I want to do my PhD from? Because there's prestige that comes with being in the best of the best of these universities. And I was lucky that I got into a school of psychology that is number 22 in the world.
Wow.
And university that's among top 1% of research intensive universities in the world.
Is that the
So,
University of Queensland?
yes.
In Australia, yeah.
I got
Number
into
22 in the world. Wow.
yes, and I got the support and I got the
Mm.
resources, and the training is intensive. And once you get to the other end, you feel like it was worth it.
Yeah.
So that's what I would say about my PhD journey.
Wonderful. Now that you graduated, was it last year, 2023?
Yes, I got conferred last year in November.
Oh, okay.
October, it's around
Congratulations.
October. It's around October, yeah.
October last year.
Yes.
Any plans for postdoc, or are you only now looking to be more productive in your newfound freedom after the doctorate? Will
Yeah,
you be
at this
thinking
stage,
of
actually, I'm
postdoc
doing
or only one? Yeah,
no.
sorry. Hmm?
I've always been excited about research. Like I said, I started my career as a research assistant back in 2008.
Okay.
So the only work that I've always done and done so well is being in the research space. And that's what got me up for my postgrad trainings and my PhD. So up until in the research space, I'm still in different research networks with different universities, different parts of the world. So there's some research that are active and going on. Also starting my own career path post-doctorate. So basically, I'll be joining one of the teams in Nairobi. That's the Institute for Human Development at Aga Khan. So I'll be
Okay.
trying to do some research with them as part of my postdoc experience.
Amazing. Yes, I've been at the IHD. It's a really wonderful institute, and congrats for that, for joining them.
Thank
So
you.
I see also around 16 years ago, around 2007, you started the Psych Health International. Is that your own registered practice?
Yeah, actually, that was a practice that I had back then because I was always getting these. I was part of the church, and
Okay.
always see parents coming to you with. They would always come actually to the clergy, for help, and most of these issues they don't
Mm.
prayers. So some of these issues just require sitting down with
Mm.
someone, creating a space for them to tell their story.
Right.
When I
Mm.
started doing, a lot of people were coming to me, and then I said, instead of doing this as part of just being in the ministry, why don't I just go into a bit of private practice?
Okay.
So I got into the private practice, and in the private practice, so I started to, yes, have these clients come and I would work with them while I was also doing my other job, employed.
Okay.
So that's how it went for me. So Psych Health was a really good program because I also had other professional counselors join in. And
Okay.
yes, it was good. We were working with teams from South Africa and also Uganda and
All
other
right.
places. Yeah, we made it like a thing. So
Okay.
we were using that as a basis to train other
Mhm.
therapists. So, like, it's granted some of the trainings that we even subject our master students to locally, they are not as robust,
Mm.
and the trainers themselves are not well equipped.
Yeah.
One thing you are doing is you are getting like really good trainers from out there. They will come to Kenya, we go to Uganda, or go to another part of Africa, and
Right.
get those who are already in that space trained. So, like in psychological assessment, in psychopathology, how do you
Mm.
do all the you do run the assessments? How do you write all these reports? How do you do like uh, like brain exams and all that? So
Wonderful. No, I'm glad you've given us the experience of both being employed, having been a full-time student, and also being in private practice. So I think you're one of the highly successful psychologists in Kenya. I think I'm open to more partnership, working especially to increase the likelihood of our practitioners improving their career paths. I like how you put it, that it's really up to someone to take a stand and, take on their career. And that's what I'm getting the insights from, how you've managed to transition each step. So it was really, really wonderful having you. I don't know if you have any parting shot or closing remarks.
Yeah, what I would say is that
Advice. Yeah. Mhm.
psychology is so closer to my heart. And one thing that I know is that we really have serious gaps when it comes to training within the local setting, and particularly within our public universities. Uh, you, I know most of the public universities that we have, you'd find maybe just one clinical psychologist or none. And yet we still have these programs going on. So I'm like, who's training these people? Who's training these students? If we don't actually have people with formal qualifications in the field. Having said that, Kenya has a big potential because psychology is a response to some of the socioeconomic pressures that society experiences. So right now, you see there are cases of like suicides, there are cases of lots of road accidents, there are cases of separation and divorce, there are cases of truancy, drinking in childhood, there are cases of lots of cases that border on, I don't want to call them mental illnesses, but I would want to call them like externalizing behaviors and internalizing behaviors, which are pointing to underlying issues. These are problems. And so the promise that psychology holds for this population is we can be a solution to most of this, if not all. But that will only happen if the space is opened up and we professionalize the space and we make it visible. And we also destigmatize the practice of psychology. Psychology is not about mental illness. Psychology is about making people more creative, more content, and also more competent in all aspects of their lives. So we're not just here because someone has depression or schizophrenia, schizoaffective disorders, or they had ADHD or autistic. No, we're here because we want to work with human beings psychotherapeutically so that they can function holistically. So this is something that had, and I hope I'll be able to, if I find opportunity to talk to some young Kenyans, up and coming psychologists, I'm will be the mentor and also to be part of the team that would actually see psychology coming to what it's supposed to be in Kenya.
Wonderful. So likewise, I'm also open for your invitation. I'll definitely be inviting you. In fact, just make room for me in the year, but I'll use your time. I know you're a busy man. I thank you so much for your time. I will be inviting you. You also feel free. Likewise, we can partner. I think there's a need for mentorship. Some of the historical facts you mentioned, I was just sitting here thinking, some of our young practitioners don't even know what happened in the 1990s and before that. They found some system now running and they don't even know. There's not even enough of that story being retold and the different perspectives and the nuance around what it took for those of us who've been pioneers in the field, especially in the policy side of things. There doesn't seem to be enough write-up also in terms of that as well. So that's a challenge for us. I'm also a researcher, so it's a challenge for us to publish kinds of diverse viewpoints on how this systematic, credentialing process is supposed to happen. And yeah, thank you so much. I think this was very valuable.
Yeah, thanks, Joyce. It was a pleasure having this conversation with you. I look forward to many more.
Wonderful. So I can stop recording now.